Welcome to this week's edition of Neuroscience Updates, covering the latest breakthroughs. Brought to you by LucidQuest. In this edition, we have a range of exciting advancements in the field of neuroscience. First, Neurocrine Biosciences has presented 48-week data for INGREZZA, showing that 59.2% of participants with tardive dyskinesia, TD, reached remission after 48 weeks of treatment. These results were consistent across both psychiatric diagnoses and doses, which included 40 mg and 80 mg. The findings support INGREZZA as a long-term therapy for TD and were presented at the 2025 Psychiatry Update Conference. Moving to gene therapy, the FDA has cleared SNUG-01, a first-in-class TRIM72 targeted therapy developed by Sinugene, for a global phase 1/2a clinical trial in ALS. This therapy targets non-familial ALS with a multi-pathway neuroprotection strategy. The strong preclinical data, alongside investigational and investigator-initiated trial results, has paved the way for the global trial to accelerate development. Domain Therapeutics has made significant progress with their oral PAR2 modulator, DT9046. This drug is in the pre-IND stage and is the first oral, allosteric PAR2 targeting treatment for inflammatory diseases. It shows promise in treating Alzheimer's disease, inflammatory bowel disease, arthritis, and neuroinflammation. The oral delivery format offers a convenient, potentially disease-modifying treatment with an enhanced efficacy profile and a reduced risk of resistance. In Alzheimer's disease, Longeveron has received FDA alignment for its Alzheimer's Biologics License Application (BLA) pathway. The FDA has provided positive feedback from their Type B meeting, which now paves the way for a pivotal phase 2/3 trial in 2026. Lomecel-B, laromestrocel, has received both RMAT and Fast Track designations, with a favorable safety and efficacy profile demonstrated in the ClearMind study. This study will focus on patients with mild Alzheimer's disease. Sanofi's Tolebrutinib, under priority review for progressive multiple sclerosis, is gaining attention. Tolebrutinib targets disability progression in non-relapsing secondary progressive multiple sclerosis, SPMS. It is the first Bruton's tyrosine kinase, BTK, inhibitor to penetrate the brain and address smoldering inflammation. The FDA decision is expected by September 28, 2025, and it is also under review in the EU. Quiver Biosciences and Dup15q Alliance have joined forces to advance ASO, antisense oligonucleotide, therapy for Dup15q syndrome, a rare neurodevelopmental disorder. This collaboration aims to reduce elevated UBE3A gene levels. Quiver's GPS technology, which integrates AI and human neuron data, optimizes therapy, and the partnership is making progress toward a disease-modifying treatment in preclinical development. Lastly, Plus Therapeutics has launched its new CNS cancer drug under the brand name REYOBIQ. This rhenium Re186 obisbemida is under clinical investigation for leptomeningeal metastases and recurrent glioblastoma. The FDA has granted conditional name acceptance, and the new branding aims to boost recognition ahead of the future NDA submission. That's it for this week's Neuroscience Updates. Stay ahead in neuroscience research. Like, share, and subscribe for weekly updates. Visit www.lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.